So everyone is set for one of the important topic when you come to the teaching. And here, though the heading I kept it as Pramana, previous one. A protocol for Chikitsa. But what I am going to do here is, in the last session, I made you to have how to get connected for Padartha Vijnana with the students. Now I am going to do with the second year. Just we are had a lunch now. We go to one step ahead. We'll go to second year Charaka now. So that's the topic we are also going to. That's the subject of ours only. So in this Pramana, I touched a little bit with the most untouched section, that is Indriya Sthana. So I'll be using the Indriya Sthana here for understanding Pramana and how the chapters are arranged. So in the Vimana Sthana. These are the 2 points I am going to discuss here in the Pramana. Little bit different from the morning what we had done. So why I taken this in this way is, one responsibility was as a first year teacher, the incoming draw mind with the basic sciences in their mind, how to tackle them. That's the one responsibility what we have. Second is, we have all the subjects are there, and in between one Charaka Samhita is there. And usually the people or students feel like already studied in Roga Nidana, or it is there in the Kaya Chikitsa, and why once again Charaka? As a point of student I am telling, not as a teacher. Teacher, everyone knows the value of it. But as a point of student, when we are learning, we always have that feeling. It is getting repeated. So how to avoid that repetition? What is the uniqueness in teaching the Samhita itself? So with this interest, because this topic is teaching, learning, research and practice. That's what the topic for Pramana given in the this CME. So I'm just touching I'm not touching the research part. Intentional, I'll left it. So my main concern here will be how to motivate the student. Reading directly Samhita itself is why it is important. Why can't we rely on the other subjects for reading the Samhitas or understanding the Samhitas? So Samhita has something unique that can be learned only by learning the Samhitas. And Pramana is the best tool to explain this. Why? Because as you know that whole of the Charaka Samhita, whatever is written, it is based on what they observe and what they experience, and that get documented, and we call it as Saptopadesha. So when it comes to the learning, so we have Aptopadesha first, but it's a learning phase is over. Next always it is the Pratyaksha and the Anumana. That is the two important things for surviving as a Chikitsaka. Once we are completed with the Aptopadesha part, then comes it. That's why they themselves say that when it is called the Jnanavan. Jnanavan means who is really to be called as Ayurveda Vid. That is the criteria for saying that we are Jnanavan is we should become Ayurveda Vid. So Ayurveda Vid is person who is expert in explaining the things in the form of Vakyashaha, Vakyartashaha, Artha Avaivashaha. Then we will get a degree as Ayurveda Vid. Now we call it as Vaidya, but that's the Ayurveda Vid. So when who becomes that level, then he says 2 years enough. So most of us, mostly we find it very difficult to become Ayurveda Vid, even though throughout life we study also, never Samhitas are going to be so easy to say. The saying it Vakyashaha, Vakyartashaha, Arthaveshaha. So today's presentation I limit for the textual learning and teaching for the students. So with that intention I presented this topic on Pramana. Yes, next one. So I used the tool because Pramana as a tool to explain or find the evidence. So that's why I started with Na Matra Matramapyatra Kinchit Agama Varjitam Te Artha Sagrantha Bandhasa Sanshepaya Kramonyata. That's what he has told. So I'll just apply to the today's presentation. Whatever I am saying today, nothing is Agama Varjita. Everything is there in the Samhita. But only thing is, for today's presentation, I just changed the Kramo Anyata. I just changed the Krama so that the same Samhita can be understood in a different way, so or it can be understood in a better way, so that we can make the student have the importance of Samhita reading directly. Yes, next shloka. Iti Shastrena Yadrishtam Drishtam Praktikshatascha Yat Samagatam Tadubhayam Bhuyo Jnanam Vivardhe. That is told in the context of Shastra Vidhi actually. So he says, what is important is Yat iti Shastrena Yadrishtam Drishtam Praktikshatascha. That is wings of the bird. That's what commonly it is being told. Two wings of the bird. Whatever we see, whatever. So it should go hand in hand. Etad agama siddhatvat pratyaksha phaladarshanat prayogyam mantravat tatra tantrajnana visharadaihi. So it's very clearly he's stating once again, pratyaksha phaladarshanat. See, that is still saying that whatever is there in our Shastra, it may be Charaka, Shushruta or Vagbhata, wherever, whatever they told, pratyaksha phaladarshanat. Because there is usually the controversy comes whether the Ayurveda to be considered as evidence-based medicine or not. So that evidence is there in the Samhita itself. They are directly saying that whatever is there in this text, it's all are pratyaksha phaladars. They found this result directly. That one only is documented. It's not third party writing the book. Most of the time now Ayurveda writing is third party writing. Third party writing is no originality. Most of the time it is a compilation and then saying that the authorship is me. But no, some Acharyas told that it is me, the authorship. But they given the credit that, but whatever they saw, that itself is being written here. So that's why it says, Prayojnam mantravat tantram tantrajnana visharadehi. Mantravat. Because usually in the Indian scenario, the chanting a mantra, it becomes unquestioned. Or it's most of the time it is never questioned. It just comes in the tradition and we just utter it with the faith that it's really going to give the benefit. We never question it. So in that way he says, there's no need of questioning. But it doesn't mean that you should not question. He has not telling that one. He is just telling that what is the interest of saying by the Acharya says, whatever is told here, it is follow the tradition. Along with the tradition, there is a practical approach here. That's why Agama and Pratyaksha both are combined here in presenting the Samhitas. Yes, next one. Tadeva metane vayuvadi rupakarmani avahitaha sammyag upalakshayet agama pratyaksha anumanaihi anantarancha desha kala matradin pramani kritya ashveva upakrameta iti. So here, what they are saying is how to use the pramanas. Pramanas gives an overall idea of the subject. That's why he says it is in the context of dosha pariksha. So there he says, Samyag upalakshayet agama pratyaksha anumanena. First use the agama, pratyaksha and anumana. Collect the information. Once the information collected, that has to be interpreted. That's why the Charaka says yukti is needed. So along with so when it comes to the collecting the information, that's enough. Anumana and Aptopadesha is enough. But when it comes to the execution, so we require because Pramani Kritya, that's what he says. You have to justify your approach with the Desha Kala Matra Adin. So considering all these aspects, then only whatever information we collected by, maybe you say that Darshanas Prashna Prashnehi, or you say that it is Aptavadesha Pratyaksha or the Anumana, whatever it is. So get these informations and then only we can use it. So simply, why this is important, this sloka emphasizing is, a patient comes to us, less than 60 seconds we'll send them out. Because we emphasize a lot on Pratyaksha, Anumana and Aptapadesha. But we forget that the patient may have this presentation in a different way. The reason may be entirely different. So our many a times are not having this understanding that itself may cost a lot. So whatever we are seeing the patients, so we need to, once we get a superficial idea, that has to be analyzed and then it has to be applied. So that's what is this particular shloka is telling us. Yes, next one. Yes, previous. Yes, this is correct. So at once what you felt? It's some lines. Correct? Agreed? Yes, there are lines. Anything else there in that? Huh? How many animals are there? That's what our knowledge, see, when you know about Aptopadesha, our Aptopadesha and Anumana, we'll be getting the complete picture. When you do not know Aptavadesha, all of a sudden I put this slide, she felt like that slide is useless. That's why she wanted to go to the next one. So, because previous one only, keep it, I have still half line to complete. So, when we saw at once, because we are not having any idea, I didn't tell anything, connecting words I didn't tell. Simply she changed the slide, so I kept mum. So, you didn't feel like it is some scratching lines, nothing is there in it. But after a while, now every animal face you can make out in too many animals, all animals we can make out. So what is required from our side is a keen observation, a attention. That's what acharyas expect from us when you are using the pramanas. So pramana should be utilized with the full use of our buddhi. So then only we have the use of pramana, or pramana can be called as pariksha. That's what they say. Or in the context of hetu, Vadamarga, they tell it as hetu. Means they are the reasons to justify the prasidhya. That's what they are telling about the pramana. So all these are possible. It's only when we utilize it in a right way with a due attention or due concentration, then we have a meaning for this. Otherwise, a patient coming with a difficulty to walk. I'll just tell you the experience of 2 days back. One patient has come to the OPD. She is a girl, unmarried, 24 years old. She came with a difficulty to walk with a waddling gait. So when she came inside, I told what is happening. She told that I'm not able to walk. I told what is happening. Even I'm not able to sit. Okay. So I just asked her, since how many days it has happened? It's just 1 week back. Since 1 week it is happening. As I see the patients for Panchakarma OPD, so usual thinking of waddling gait and the patient is not able to sit. So I started telling her, where is the pain? She is telling, pain is, I cannot tell you, but I cannot walk, I cannot sit. So when I started telling, I cannot tell you, now I have the curiosity that the question has started in the mind. It's not the gradrasi, that the usual patient comes to this OPD. This is the wrong patient sent from the screening to the Panchakarma, that's what I felt. I just asked the patient, you go to the Prasuti OPD and we'll see something. So I just sent to the Prasuti and I told the madam calling, just check her, it looked like something because she was telling that she can't. She can't tell that one. And when we examined, to our astonishment, that Dadru, why Shushruta has told Mahakusta, we understood after seeing her. Actually, that is for 7 days, she didn't take bath and she didn't take, because pain was too much, because of the summer is very peak there. So because of that, one whole of that skin has peeled off, and it has over that, there is a pustule pocket in both the buttocks as well as around the vulval region. That is the reason. And how is she sustained is the question what I had. Why I brought this one as simple, one attention with the preoccupied mind. If you see something, we'll always perceive the same thing. Keep preoccupied, take it out, and then we see the same thing, we'll see many things in that. That's what has happened here now, just now. That's what we need to teach our students. So they should see the things not with a preoccupied thinking, rather than use the pramanas with the interest of analyzing the things, or with the interest of understanding the what we say horizontal or parallel thinking. So that will helpful for a chikitsaka. Then pramana has a value in for the patient or for the vaidyas. So that's a similar one. I'm telling the one more, this one also. One more. Yes. It's a plain now? Plain orange color? Yes. Next one. A red color. Next. Circle. Go previous one. Can you try to see this one? It's really a color, only color? Yeah, afternoon, after lunch I am doing this one. So unless I stimulate the indriya, my session is going to be difficult. At the end of 30 minutes, most are, because posture is said to be, for in a clear class, most postures are like this. It's always because in as per the Tirumalar Varmology, we have a point here in both the side of our cheek. That is the one which induces the sleep. So when you put the pressure on this, unknowingly we are inducing the sleep actually. So that's why whenever you get this posture, be careful. It's a alert for the teacher as well as for the student. So immediately try to distract then and there only, so that you will continue with the class with the neck upright. Otherwise, by the time, yeah. So I had too many. That's why I need to explain this one. And maybe as a teacher, it will be helpful for you also. So anyway, so this is the thing. So anything is there in this? It's read now. Previous one. Yes, anything is there? Try to see. Ah, yes, fine. So now the sum indriya is working. Yes, we'll go to the next one. Next. Next. Yes, there is a all, but seeing is not so easy, right? That's why the Acharya has given the pramanas. Every time we should get the things superficially without exploring is not possible. We need to put our effort to extract the things. That's why they thought that being for a chikitsaka, one pramana is not enough. We need to have multiple way of exploring the things, so that at the end result we'll really get pratipatti in our chikitsa. So that's what the word they told at the Dashavida Pariksha last, right? Pratipatti, or why they should become pratipattiman. So this is possible only when we utilize the pramana in the right way, so that always we will be successful as a chikitsaka. Yes, the next one. Yes, there was a frog in that red color, so it was missed out. Yes, next one. There was a tiger in this one. Yeah, if you want to see that back once again, all three are there. So all three are there. So if the only thing is brightness is reduced, then we will see the background well. That's what is done for the presentation purpose. That's all. So the next one. So we know that how many ways can come to us, how much variation in our students. Even though we teach for 15, 20 years, every batch is a new batch, right? As a teacher, it's a challenge for every batch. We can't expect that all students in every batch is going to be same. We need to have variation is a rule of nature. That's what they are telling here. There is yavantaha. Variation is possible. So when Charaka himself is told that many years back, we have to agree with, right? So variations are rule of nature. So with this variation, we should be able to reach our students, right? So therefore, the next one. Charaka, one of the important evidence or one of the important tool where Charaka state directly how he has observed a amurta. So he says, कर्माणि बहिशरीरेभ्यो वा भवन्ति तेषाम् अवयवान् प्रत्यक्ष अनुमान उपदेशैः साधयित्वा. See, his sequence has changed into prataksha, anumana and upadesha. For whenever it comes to the chikitsa point, or when we want to apply something for practically, we have to utilize always Acharya has given importance to pratyaksha anumana. Something it cannot be perceived directly in the clinic. Someone has to tell us, then Upadesha comes first. Upadesha comes first. Because with the knowledge of Upadesha, we have to use the Pratyaksha and Anumana. But when it comes to the Vayu, he is comparing this one with the Bahisharira Vata. So already he has given one evidence of Pratyaksha there. Directly he has given evidence of Pratyaksha. So one is, I am talking about something which is not known, that is Anumana. But I am also comparing that one with something which is known, which is we are experiencing every day. So he uses the Pratyaksha here as a first one. Pratyaksha Anumana Padesha. Why I brought this one is, so whatever is told in the text, we are already had a reference saying that it is Pratyaksha Phaladartana. But Charakas, Acharyas repeated these things in the context wherever it is needed to indicate that there is a need for using the Pramanas to have the proper information. For the information, we require the Pramanas. Yes, next one. This is what I am going to, as I told my today's center of presentation, I'll be presenting using this Pramanas in these two sthanas. One is Vimanasthana and Indriyasthana. And here I used the tool of Aptapadesha for understanding the sequence of arranging the chapters in Vimanasthana and how our Pratyaksha and Anumana will contribute this understanding. So as we know that the uniqueness of Vimanasthana is Niyati Jnayati Anena iti Vimanaha. And what? Dosha Vesha Jadini iti. So whatever we are doing in the Vimanasthana is we are measuring. But what we have to measure? Why we have to measure? So that we understood in the Trisreshaniya we have to measure through the pariksha. The Chaturvida pariksha is told that. I told the yukti will be included in Anumana, therefore it is not separated. So they told whenever you want to do the pariksha, means you are going to use the pratyaksha anumana aptopadesha. So without aptopadesha as a first tool, using the pratyaksha and anumana is difficult. That is the same sequence is followed here in arranging the chapters for pariksha, for the pariksha. The first two chapters we have. So next slide. So iha kalu निमित्त पूर्व रूप रूप उपशय संख्या प्रदर्शन विधि विकल्प बलकाल विशेषम अनुप्रवेश अनंतरम. That is after the having the knowledge of these things, then he is explaining about pariksha. So this we are going to have this information here in the Vimanasthana. Yes, next one. So what is this Vimanasthana? It is a simple protocol for the simple learner, complex protocol for intelligent learner. That is what the Vimanasthana. Because usually student ask this question. When you teach the Vimanasthana, we have Trivida Pariksha in the beginning, and at the end we have Dashavida Pariksha, right? In between we have Krimi, and there Janapada Dvamsa, one more chapter, and in between is Rudya. What is the connection of all these things? Why we need that? He says his Uddesha, he has told us, he want to explain, or Acharya want to tell us about the mana, miyate jnayate. But when it is chapters are kept, there are chapters that feel like really how it is going to contribute for pariksha. So that's why the question comes to us. So there is a way why the Charaka has kept in this way. So that's why I told, if you are a simple learner, it is a simple protocol. Very simple protocol, because he has told that in the beginning in the Matrashitiya, that is while after the Beshal Chatushka, when starting with the Shastra Chatushka, there he has told that Ahara is the most important one. That is what the key here in the understanding the person. So in the Rasa Vimana, the first chapter Vimanasthana, yes, next. Starts with the Vimanasthana. So here I just, for a connection, I just brought the Nirdesha has highlighted here. As you know that in the Nirdesha is the place where we get the explanation of Pariksha. And we know that what is Nirdesha? Nirdesha is for Vaidya. So Vaidya has this Nirdesha in the Sutrasthana. Now in the Vimanasthana, context has come for using it. Because Pariksha has to be done. And how to do the Pariksha? He has told already. The Parikshas we are using these 4 Pramanas we are going to do it. So it's clear. So now that means it's very clear why the Vimanasthana is kept in this way. It should have a relation what we have Nirdesha we received in the Sutrasthanam. So the next one. So the next one. So while explaining the Rasa Vimana, so there is an importance is given for 4 Prabhavas, and that is what Dravya Prabhava, Dosha, next slide, Dosha Prabhava, Vikara Prabhava, and Rasa, Dravya, Dosha and Vikara. This is the 4 Prabhavas explained here in the first chapter. And it is kept in this way. As we know that, we just studied in the previous presentation we understood. So, Ahara Sambhavam Vastu Rogasya Ahara Sambhavaha. There is a relation between the Anna and the Roga, or there is a relation between Rasa, that is the way we use. So, Rasa as well as the Dravya. So, there is a relation. So, because of this relation has to be Aptopadesha in the beginning. Where Aptopadesha is not given, we cannot understand how it is going to manifest. That's why they given Aptopadesha for us. Every disease is a product of Rasa. Every disease is a product of Rasa. Every Dravya has its role to produce the Vikara. So that's why while explaining the Rasa Vimana, there is an explanation of method of taking the food. But for a Parikshaka, when you go to the bedside, this become a protocol for evaluating the patient, how the Nidana Ahara been utilized. Ahara Vidhi Vidana, Ahara Vidhi Visheshayatana is actually the protocol to evaluate the Rasa. When we ask this one when we see this one in the patient, we can make out where the deviation has taken place. For this, without Aptopadesha, we cannot make use of this one. Because if the Charaka has not given this information that Ahara Vidhi Vidana, Ahara Vidhi Visheshayatana is going to play a role in the manifestation of the disease, we wouldn't have given importance for asking the patient how the person is eating and what is happening. Now it is said lifestyle has become most important cause, right? So for evaluation, we should have a protocol. So that ready-made protocol is there in the first chapter. That's what the pariksha information we are getting in the Vimanasthana first chapter. And at the same time, as it is also the chapter explains about Dravya Prabhava, so only three dravyas that has to be taken in the right way and that should not be taken in excess is explained. We should, throughout the Vimanasthana, we'll remember that there is a central theme here. So without the keeping the pariksha as a center theme only, we are seeing the Vimanasthana. So we understood the first chapter is going to be, it's the Aptopadesha we are receiving from the Acharyas, explaining what has to be evaluated in the patient in the beginning, when a patient comes to us. So first give the importance to Ahara, as our Adhikarana is Ahara Samvam Vastu. So we are evaluated the Ahara in the beginning. Now, once you know that the Prakrita method of taking Ahara, the Vaikrita also should be known. That's the immediate chapter is Trivida Kukshiya. It's just the continuation. What has explained the Prakrita Avastha in the Ahara Vidhividhana and Ahara Vidhi Visheshayatana, that is being utilized, and practically he shows this one with the chapter Trivida Kukshiya. So now in the Trivida Kukshiya, first slokas, if you remember, Matravat Ahara Lakshana. So this Matravat Ahara Lakshana is Pratyaksha Phaladarshana. You just see all the Lakshanas given the Matravat Ahara. So all the Lakshanas are what the patient experiences is being documented there. That is nothing but Pratyaksha. Directly he says, see this one and find out what the patient is doing, whether it's a Matravat or Matravat. Second chapter is Trivida Kukshiya. And once we're done with these two, we may feel like Ahara is the whole and soul of the things. So with this Aptopadesha, that's why the next chapter, yes, next slide. Next. Yes. So we understood in the Trivida Kukshiya, next one. Yes, Janapadodvamsa. The third chapter is Janapadodvamsa. Now, if you remember the Chakravarti commentary there, he says, Sadharana Roga Karanam Abhidhatum. So, he is Bahujana Sadharanam, Vata Jala Desha Kala Rupam, Sadharana Roga Karanam Abhidhatum, Asadharana Cha. Tatra Asadharanam Pratipurushaniyyatam Janapadodvamsaniyo Abhidhiyate. This last line is important for us. So in the Janapadodvamsa, apart from the person's own defect or default, what disease he is manifesting, there is one more cause beyond that one. You have to evaluate that. So don't limit only for Ahara. There are some causes which are beyond Ahara. So when you are doing the pariksha, that's why once again it is Aptopadesha for us. If Charak has not given this highlight, you would have taught every time Ahara Sambhava Vastu, Rogasya Ahara Sambhava, so every time Ahara only should be cast. But it is not the case. Here's Vimanasthana Pariksha point. So he is telling, don't concentrate only on Ahara. There is rather cases which are very specific to each individual. Prati Purusha Niyatam. This is very individualistic in the approach, and that Asadharanam. That is not very common. So, when you evaluate the case, we need to ponder on some of the things which are not related to Ahara, beyond Ahara. It may be there is a field is very big, and here their concern is one is Janapadodvamsa. But we'll take this understanding here. What we are understanding is upon doing the Ahara, there are some things that also should be considered when we are putting into the subjecting the person into examination. Yes, next one. So there he says, one is Janapadodvamsa, Vyadhi Sadharana Hetu. Say here only he has brought the context of Kala Akala Mrityu. That's why I told. Some things which is beyond the control. He explains the Daiva and Purusha here, Paurusha Karma here. So this is not in our control. There is no Hetu can be evaluated in the patient, but still the patient is suffering. Very common one, Shvitra. There is no Hetu. There if you go on seeing only the Ahara, we are a failure. So we need to something beyond now. So what I am telling you, understanding now why the Janapadodvamsa is made in this way. One is Janapadodvamsa, but it's not only restricted to Janapadodvamsa, rather he brings the other reasons for Kala and Akala Mrityu, so that we should broaden up in evaluating the patient, finding the Hetu for the Vyadhi. Yes, the next one. Next one, previous one. So next one is, now we have information is ready. We have the information. There are two ways manifestation of Vyadi. It may be with the direct cause of Ahara, or it may be beyond the Ahara. Now Charaka gives us, now you come and with this information, you go and interact with the patient. When we are interacting, there should be a way of documenting. So method of documentation is given as Pariksha as Trivida Roga Vishesha Vijnaniya. So word is Vishesha Vijnana. Just now in the last session we studied what is Vishesha? To emphasize on one particular quality. Prataktva, right now? So what we are going to do with this Pariksha? At the end we should be able to deduct or deduce to one point. That should be the end result of using these three pariksha. So that's where we have to end with. That's what it is, Vishesha Vijnana it is. Not simple Vijnana. Triviroga Vijnana should have been, but he says Triviroga Vishesha Vijnana. So that we'll get the unique information or specific information required so that we'll result in one particular information. So here we are using all the three parikshas because with the Aptopadesha, we are getting the information so that we reach to the one particular thing. Once we got some information, because patient cannot explain the next slide. Next. Previous. So the next one is, see, we cannot, up to this one we have now in our hand, information is there. We explain this information, whatever is given by the patient, so how it belongs to his body. But by being a Vaidya, it's our responsibility to make where is the cause now. Because we have some information related to Hetu, whether there is Ahara involvement or there is no involvement of Ahara. We do have some information that we deduced out of the Pratyaksha Anumana Pariksha. Now using this information, analyze what is the cause behind it, what is the srotas involved in it. Why the srotas is important here is, as Charaka emphasized on sroto specific chikitsa is indicated, it's the speciality of Charaka, therefore he has to bring in the pariksha part only which is the srotas involved, we should be able to deduce it because we have done the Trivida Roga Vishesha Vijnani on the patient, we should be able to say which is the srotas involved. Once you get this information, now we have two information with us. We have some signs and symptoms with us, and we made some signs and symptoms related to srotas we have. Now, with this information, that's not enough to go for the pariksha or go for a plan for the chikitsa. Therefore, we have one more chapter to explain this one. Yes, next one. That is Roganeka Vimana. So he says, Purvadhyaye, Suto Rupa Adhisthana Bedena, Rogam Anabhidaya, Pravavadi Bedena, Rogan Anabhidatum, Roganekam Vimanam Uchyate. Roganekam iti Roga Samoha. So our one approach he is told based on the srotas. But every time whatever the information we get should be able to be fit into the srotas may not be possible. So that for planning a chikitsa, apart from the srotas, there is one more method for planning the treatment or concluding our examination. So that's what they are given as Dashanika. So in the Roganika in the beginning, the shloka says about Dashanika. What is the use of this Dashanika is where you are not possible with the where it is not possible to examine with the srotas, we have one more method to conclude our examination part is, you have what is the desha it has manifested, what is the hetu involved, and how the vyadi is getting progress, when mrudu or dharuna. Yes, next slide. So that the mrudu or dharuna, or it is the swadosha nimitta, or because of agantuja, or it's amashya samutta, or Pakvashya Samutta, and whether the Vyadi is going to be Sadhya or Asadhya. So we are getting some more information with the Pariksha. So now what we change the Pariksha's method is, ready-made was there in the beginning, but with this ready-made information, we are trying to have the conclusions by using the knowledge of Aptopadesha, but this Aptopadesha should lead us to the practically using this information for planning a treatment. Yes, the next one, previous, Vyadhitarupiya. Now, with all this information in hand, before we execute the treatment, for whom we are executing is very important. As we studied in the last presentation, Desha plays an important role, whether it's a Shat Padartha or it is Pramana. Without the Desha information, we cannot proceed further. So there are related to the Desha information, we have the Vyadita Rupiya. So we are going to use this information as Sattva and Sharira Bala. Based on that, we are going to conclude that whether the person is having the Guru Vyadita or Laghu Vyadita. So now we are Pariksha part, one part is complete. So we had Hetu is known, and we are also knowing that this is manifested. Some problem with the mic. Shall I speak directly? So this is what we have first-hand information using our Atmavadesha, Pratyaksha, Anumana, we are ready. Now once we are having this information, before we execute this information on the patient, one, we can superficial information only, we can have a planning and we can go ahead with the planning the treatment. If not that every case is so simple that 1 plus 1 is 2, or it is true in the Ashtanga class explaining about Vasavriddhi or the Raktavriddhi Lakshanas. It's never true in the practice, right? In the Raktavriddhi we study the Kushta, and when it comes to the practice, writing the Kushta with only Raktavriddhi is not possible. So it's entirely different actually. It's not so easy how we have the explanation in the textbook. In the same way, it cannot be practiced. That is the limitation what we have. We need to overcome that one. That's why the chapter name goes as next one, as Roga Vishakjatiya. So the name of the chapter goes as, yes, next one, that's one only. Roga Vishakjatiya. I missed that heading. Roga Vishakjatiya. Roga Bishakjatiya. Bishakjatiya means chikitsa. So we are going to able to tell the chikitsa to the specific condition. When it is simple, we have a specific approach from ahara to the dosha. When it is complex, we require to have some more specialized tools for examination. That specialized tools for examination in detail, that's what he has given as Dashavida Pariksha Bhava, and one among that is Athura Pariksha. So either we'll use from the Rasa Vimana to Vyadita Rupiya, or it's not possible with this tool, then we have to adopt this sophisticated way of, or a specialized way of approaching the patient. The small, even a very minute component of the Athura has to be taken into consideration. So that's why we have a detailed Athura Pariksha. So that is how the Vimanasthana contribute for us to come to a conclusion what is it. So therefore only the end of the Vimanasthana is the collection of Panchakarma. Panchakarma Dravya Sangraha is there in the 8th chapter. Last part is Dravya Sangraha. When you are able to conclude on your pariksha, you should be able to select the medicine also, right? So we done a pariksha, but for the selection of medicine, we always go with the teacher's prescription or the elder's prescription, right? We forget this one. Why it happens so? Because we are not confident on concluding our pariksha, that's all. If you are able to conclude on pariksha, then we should be able to decide on our dravya. No need of any prepared prescription is not required. We ourselves, we can come to a conclusion and select the medicine. So that's what we have the two division or the two way of approach in the Vimanasthana. And whatever the pariksha we are having, here in the Vimanasthana, he has explained us to become a specialized in pariksha. So that's what the part here in Vimanasthana. But it's one more counterpart for a pariksha point of view. What we have is the Indriyasthana is the next one. Next, this is just what I told. Yes. So the next part is most of the previous one. It's the same thing I told, what till now I told. First we'll have rasa, which will explain about hetu. And then we see this applied in the Trivida Kukshiya, that is Ahara Matra, Am and Nirama. And then we have if you do not get an answer with these two, think about Asadharana Hetu, Or if you got answer, consider it as a sadharana hetu. And then do the pariksha for each patient and collect as much as possible information. Once you have the information, reduce it into srotos wise. You are able to do this one, it's fine. If not, we have one more alternative. With the Dashanika, make use of the Dashanika and find the answer. And before executing anything, be careful, see that there is a Vyadita who is suffering with. So this is what Vimanasthana is. We understood the Pramana with the interest of Pariksha in the Vimanasthana. Similar way, we'll see some things, not too much elaborately. Why I brought Indriyasthana? Usually the student feels Charakas Indriyasthana is for 2 marks question. Right? 5 questions come from the 2 marks or 5 marks 1 question. So that's what the Indriyasthana is required. There are some important things we need to give importance. At least that much should be conveyed to the next generation. It's not whole detail of Indriyasthana, but some aspect that we need to give the importance. We have a protocol, just now I told, when we are seeing the patient directly, always Pratyaksha and Anumana plays a role, Aptopadesha is secondary. Here in the Indriyasthana is the place where Pratyaksha and Anumana is the most important and the least is Aptopadesha. Holding Aptopadesha, we cannot declare a patient dead. Can we declare? Because Charaka has told you this Lakshanas are there, so you are dead. Can you explain? Can you tell that in that way? No, we can't do it. Only way to say this one is, we should have a practical experience of declaring a death. If you have that one, then only I can do this. So, Indriyasthana is a place where we have elaborate explanation of Pratyaksha and Anumana. Aptopadesha, very, very less, very minimum of Aptopadesha. Rather, he has not emphasized on the Aptopadesha at all, because this is very practical examination, what he has explained in Indriyasthana. Yes. As the sequence of the chapter, just this sloka itself, he says, see, Pratyaksha Anumana Upadeshe Ayusha Pramana Vishesham. So, Pratyaksha Anumana is the most important and the secondary importance for Aptopadesha. So, Aptopadesha cannot help in declaring these things because it's a place where you have to declare the Ayusha. Right? Because this is one of the ways the Charaka has defined the Ayurveda. Therefore, it is important that Troktam Ayurveda Savichyate. So, without declaring the mana, there is Ayurveda is incomplete. So, Indriyasthana has its importance. But just see the sequence of explaining the things. First one is Varna, Swara, Gandha, Rasa, Sparsha. So, all these are? What these are? 5? Padartha Vijnana teaches. Indriyarthas. So, first is importance given for Indriyarthas. Next, Chakshusha Shotam Chaganam Rasanam Svarshanam. What it says? Indriya Adhisthana. So, first is for Indriyartha because it's easy to evaluate. Arthas can be evaluated very easily. Therefore, first thing to declare or to say anything, if the person is going to survive or not, or he has some prognostic point of view, it is good. Because we are seeing, understanding Indriya, what we are going to do is, person is fit for Chikitsa. If these things are not there, that means you can progress with your treatment. So that's why we are using the Indriyasthanas, though he is told about the declaring the death, but it is not only the purpose. Because Pratyaksha Anumana Aptopadesha Ayusha Pramana Vishesham. What he want to say is, person is going to survive or not. If you are surviving, we are going to progress with the treatment. So, first 5 is Artha, next 5 is Indriya, next is Sattvam, Bhakti, Shaucha, Sheela, Achara, Smriti. What it is? Sattva, Bhakti, Shaucha, Sheela, Achara, Smriti. Manasika Bhavas. That's in the Nidhanasthana, Unmada. While explaining the Unmada Swarupa, these are taken, right now. So, we are taken Indriya component. We are taken Indriyartha, Indriya, then Manas. What is the definition of Sharira? This when defined, definition of Ayu? Right now, when he had defined the Ayu in this way, there should be criteria to assess the Ayu should include all this component or not. It has to include all the component. But one component that cannot be examined is Atma. Because Atma definition goes, Sindriyam Chetanam Dravyam. So already we have done the Indriya examination two way, that is Indriyartha and Indriya itself. So when we have a definition of Ayu, the Indriya Sthana explains only the its application. That's all. How to assess Ayu. So that's what the sequence what we have. And once we are done with this, next he says आकृतिश्च प्रकृतिश्च विकृतिश्च बलं च ग्लानिश्च मेधा हर्ष रौक्ष स्नेह तंद्रा. So all these are the शारीरिक component. So you got how the Indriya Sthana is arranged. What is the importance of Indriya Sthana? There is a information in Indriya Sthana. We cannot overlook it. The way the information we get from the Indriya Sthana, depending on that, we will see that it is useful or not. When simply it is given as Arishta Lakshana, it will remain as Arishta Lakshana Sthana. But explaining Arishta Lakshana in 12th chapter, what is the need of it? For declaring, it's a very important component for a chikitsaka to handle the patient or not to handle. If you are handling, what is the time left with you? So how can you say that this is the patient is not so prognostically good? We have to refer it to the higher sensor. So this is what the sequence. And one more important thing in the charaka is when he has given this much related to the Ayu, only knowing a person is not enough. Even one of the important factors to trigger anything is the environment where the person survives. It's also important component. When you have all these things, but you do not know where the person is surviving. What is his environment? Because nowadays it's the most important in the nuclear family or in the families where we have both of them are working and the child is at home. This environment is important. That's what he says. Last component to be evaluated is Purusha Anashita Arishta is to. Actually, it is other than the Sharira, Sattva, Indriya. You give all these things individualistic in approach. But from where this person is, what is the triggering factors are there in his environment, whether it is contributing to the patient or not. So that's what we need to evaluate. That itself may be a reason why the person has attempted a suicide. Because there's environment was triggering him, so he couldn't have any chance. So that's why he gives the importance to last one. Atrakula, Bhavavastantarani cha, Veshish Samvrittischa, Vikara Yuktischeti, Parikshani. So these are the things to be examined. So I think now you understood the relevance why I took in the Pramana, the section is Indriyasthana. So that's the important one. It's the next one. Just we have what are the components he has elaborated in the 12 chapters. Just sequence I tell. So next one. Yes, just now here Tani Upadeshito Yuktitascha Pariksheta. So here he says तत्र तु कल्वेशं परीक्षाणं कानिचित् पुरुष अनाश्रितानि कानिचित् पुरुष संशयानि. But what will have its relation with the person, it should be known by Arthopadesha. You're just doing research. You want to say that the how many times person drinks the buttermilk, it has some influence on is intelligent. This is possible now in PG thesis in Ayurveda. And they'll conclude that the frequent intake of buttermilk improve the intelligence. This should not happen, no? Yeah, I given a blunder example. Why I gave this example is, if we do not have Aptopadesha, seeing the statistical significance, we will give an interpretation. That statistical significance is it's a machine. It is a mathematics. It do not have a sattva in it. It do not have any capacity to do the jnana adhikarana is not there in it. So whatever the result comes, we will try to correlate this one. This correlation is such a thing, no, it becomes a blunder in our Shastra. So that is the reason why he says, when you want to link between the environment and the patient, or you want to link the symptoms person is developing and your prognosis, always have the knowledge of Aptopadesha beforehand, not at that time, beforehand. Then use this one for concluding the patient. Yes, next one. So next. So that's why previous one. So that's the reason why nuclear plasticity comes in this way. Because the factors which will influence on the person, that factor has to be considered from the beginning when we evaluate the patient. Patient alone is not enough. Patient from where he has come, what is his family background, everything has to be considered before we conclude any diagnosis or the prognosis. That's why the Prakriti word here is told for natural environment of the patient. With this interest, the Prakriti is explained here in the, because that is how he concludes Indriya Sthana. So in the beginning only he has made it clear. It is not the Deha Prakriti he is talking about. He is talking about the environment which will have its influence, or it becomes a disease modifying factor. So that has to be considered. Yes, next one. So it's well known Lakshana Nimitta and Nimitta Anurupa. So these are the information what we get in the Varnaswariya Indriya. Yeah, that's why we have the Varnadikara here. Next. That's Prakrita and Vikrita Varnas. Next. Pushpitakam Indriyam. I already explained the sequence. Now it is easy for me to explain you this one. It goes just the sequence of, first is Indriyarthas. So Varnaswara is over. So it has to explain the Gandha and Rasa. That's what is explained here with the Gandha and the Rasa. The next one. But one interesting thing here is in the Pushpitaka Indriya, previous sloka. He says, when the Pushpitaka Indriya, while explaining the Gandha Pariksha, he has given the Rishta Bhasa and Lakshana. And he also explains that there is a chances of doing a Prajna Parada. Why to do in the Pushpitaka Indriya? What is to do with the Gandha? Any logic? Teachers. Okay, think over it. Then I will give the answer at the end. So this is the rasa, and then there is explanation of the rasa. So of course we know that rasa has to be examined with anumanena vidyat vikritimagatam. Is the next one. Parimarshani Indriya, because sequence should be completed. Last one is sparsha. But while explaining the sparsha pariksha, he has given the important who has to do the sparsha pariksha. It is the person who is prakritistena panina, person who has the proper the hands. So one who has the tactile sensation is proper, they only is eligible for doing the sparsha pariksha. So next one. As we are completed with the artha, indriyarthas. So indriya adhisthana plays an important here. So that's why he has explained here, indriyani yata jantahu pariksheta visheshavid jatamichan vishang manam ayusha tan nibodata anumanat pariksheta darshanadini tattvataha. Because indriya cannot be examined directly. That's why in the indriyanika indriya, all are indirect tool to interpret the indriya. Because indriya is sukshma, and if only we can examine indriya adhisthana, we cannot examine the indriya directly. But indriya is important component of ayu, so we cannot overlook it. Therefore, the method what is used here is anumana pariksha is used to do the examination of indriya. So that holds good even when you do the Timira examination, right? We want to say which patalagata is true. So we have to use the anumana only there. We cannot see directly these patalas, but we will use the anumana because wherever indriya itself is involved, only adhisthana can be examined. Examining the indriya directly is not possible. Yes, next. That's why one chapter indriyanika indriya. Yes, next. Yes. Next comes Purarupam Indriyam, because when it comes to the manifestation in the Sharira, we are in the context of Vyadi, and the first stage of manifestation of Vyadi is Purarupa. So it manifests in the Sharira. So Adhikarana, what we have moved from the Sharira to the place is Purarupa Indriya, where we will understand the premonitory symptoms related to the disease in the Sharira. Yes, next one. One more context, which is Katamani Shariram. So directly he is saying, Sharira is the Adhikarana now. We are talking about the Sharira. So what are the changes taking place in the Sharira? So first one we told Pura Rupa. Next it should be Rupa, no? The sequence should go, it is Rupa. That's why we have the next one is Katamani Shariram. Next is Pannarupam Indriyam. So Pannarupam, one of there are 2-3 chapters very unique for examination, what he is telling. We know most important organ in the body which can explain about the systemic disease is eye. Diabetic, hypertension, or the congenital deformities. It is like a Marfan syndrome. So it's directly linked with the changes in the eye. So how much importance to the examination of Indriya, Indriyartha and Sharira, equal importance should be given for evaluating the eye. That's why in Ashtavida Pariksha, very important, one of the component is, but most of the time we feel like Drishti is just a part. We never give the, because if you go and read in any of the ophthalmology book, they always write this line. Most of the systemic disease, its presentation starts here by depositing in the eyes. So eye becomes a very important tool. Acharyas were knowing. We are ignorant because body is not supporting us for diagnosis. In that time, they found different tools. When Sharira is not giving the information, we should have some alternative to find the what's going on in the Sharira. We are not with the only interest of seeing the. Our interest is drishti is used as a tool here to evaluate the Sharira. What is going on in the Sharira? So that's what we have Panna Rupiyam Indriyam. So next one. Avakshirasiyam Indriyam. Once again, it explains about the functioning of Indriya. So related to Indriya. So we are using this tool of eye as a tool for examination to establish that there is some changes are taking place in the body or not. So we'll use these two chapters are exclusive kept with the interest, giving the emphasis on eye examination. What is the important ruling out or doing an examination, thorough examination of eye when you examine the patient. The next one. Yasya Shavanimittiyam Indriyam, because now we had 4 chapters. Pura Rupa, we understood there is a manifestation, and we understood Katamani Shariram. So what is the Sharira? We understood Panna Rupiyam, and also we understood the Yasya Shavanimittiyam Indriyam, where now no unknown we'll examine, but known. Known means where the presentation is in such a way, such a severe presentation, it's really outright explains that person prognostically very bad. That's why he has given Sharira with some changes here. That's what the Shavanimittiyam. The shloka starts as Yasya Shave Paridvaste Harite Chapi Darshane Apanno Vyadirantaya Jneyastasya Vijanata. Now declaring that it's almost the person we do not have any chance to handle. Till now we had a prognostic point of view, are just examining our patient. If we do not find any finding, we have a chance to treat. But we reach to a level now where we do not left with anything. You have to tell that patient is going to die. So that is the presentation what he is telling here in the Nitya. So next one. When we told everything, 2 important part in Charak Samhita, we cannot forget Vata Agni. Because Kaya Chikitsa Agni Mula and Vata is considered in Nagra Sangra Prana. We are talking about Prana, and if you forget about Vayu, it's never possible. That's why Sadhyo Maraniyam Indriyam. So Sadhyo Maraniyam Indriyam, if you carefully read the whole shlokas, 12 to 13 shlokas are there. Every shloka, there is involvement of Vata. How the Vata is going to play a role in making the person have a sudden death. So what we say, MI and death. Before you understand what is happening, death. That's what Charaka explained here, Sadhyo Maraniyam. Here most of the Lakshanas do not have externally, nothing is there. Person will have different kind of pain in different part of the body, that's all. So with that, he declares that person is going to die within, either the commentator says, within 3 days or 7 days. See how advanced they are in diagnose the patient with pariksha. They are very systematic. That's the reason they could explain with confidence. Now, with involvement of Vata, you can say this is the duration. So it is the acute presentation. It's utmost care is required to handle it. So within 3 days, if the person survives, yes, in MI, we have 72 hours is passed, yes, chance of death is very less. If not, within 72, it is always higher the risk rate. So that's what the Charaka says here with the Pariksha. Examine the functions of Vata. Whatever the presentation is there, it's purely due to Vata. That's what is concluded here in the Sadhyo Maraniya. And as I told, the being Kaya Chikitsa is given importance. So next chapter must be, yes, next one. Anujyotiyam Indriyam. Jyoti has become Anu. Anujyotiyam Indriyam. Because this chapter is very important. He says, Dhruvam Maranam. In Grahani chapter, explain the importance of Agni. If the Agni Nash has taken place, Dhruvam Maranam. He has told definitely it is going to kill the person. When I so particular in saying, he should tell the tool to us, no, how to examine this Agni so that the person should not die. Right now, before that happens, we should take care of the person. So that is the reason why he has explained about Anujyotiyam Indriyam. So that he explains importance of or role of Agni in deciding the prognosis. or why we have to emphasize and evaluating the Agni or maintain the Agni for having a positive prognosis. So with this all, we are completed actually our Ayu definition is over. We are established by seeing Artha, Indriya, Sattva, as well as the Sharira. We examined everything. We got an answer now whether we'll go ahead with it or not to go ahead. So if you are all examination then your patient is ready, you can go ahead with the treatment. Nothing to worry about the death of the patient. Patient may be declared as either it is Krishna Sadhya, Yapya, or it is the, but we will not declare them as the Anupakrama. So this is what we are going to conclude with these informations. Yes, last chapter. Next. Gomaya, previous. Gomaya Churniyam Indriyam. So when he had done with all these things, so he has to conclude, there is a conclude, Parisheshya, he says, as we know that in the important, one of the Chatushka is related to Roga Chatushka. What is the first chapter of Roga Chatushka? Kiyanta Hashirasiya. Were the important three marmas, what is the first marma he has explained? Shiras. So when you are done all these things, how can you forget in the declaring the patient Shiras? You examined everything. Because it is not very important to declare, that's why it becomes the last chapter. But it is one of the organ to be examined, but it is the external organ, it's easier. So where we get information. So with this, the Adhikarana, when you see, there is a meaning why he has to end with the Gomaya Churniya. With the Uttamanga, he concludes the things as Gomaya Churniya. But in the other part is, now we have the other information, the Gomaya Churniya. Rule the Charaka follows in all the sthanas. So wherever there is sequence is given as whatever is to be told, it is not completed, then it has to be completed in the last chapter by the rule of Parisheshyat. So here we had studied everything related to Purusha, but we are not yet completed all information related to the surrounding and his environment in the family. That's where we have Duta, Outpatika, as well as Aturakula. Information we will collect. Yes, next. So we are going to consider these things and then see if his intention is only to make the person declare death, why do he conclude that Arogya Lakshana as the last sloka of Indriya Sthana? No meaning. He has done a blunder, no? No, he has not done. Telling us, I told Arishta Lakshana because there is an intention behind it. Say Indriya, but our intention is not to declare the death of the patient. We didn't complete our sthana by declaring the patient dead. We are concluding the sthana saying, if these things are not found, then declare them as Arogya. You try to treat the person and there is a scope for improving the person. So that's why with the Shubha Lakshana, he has concluded the Indriya Sthana. Yes. We should have been first, but I made it last because we are all teachers. Teachers have all these qualities, hoping this one that Pariksha Guna, what Charaka has given in the Vividashitiya Pitiya, as these are the qualities should be for the Parikshaka, hoping that we are all Parikshakas, having enough knowledge of Shruti, the good knowledge of Samhitas, having very good analyzing capacity, Buddhi, good memory, we are skillful in our subject, we have the courage to face the things, that's Dhritihi, and Hitanishevanam, we'll always practice something which is good for a long time. In the previous session also, we practice something which is really good for the future generation, so that for what profession we are, we'll give the justice to it. That's why he gives Vak Vishuddhihi, Shamu, Dhairyam, because these are important being a teacher. Now I put it only with the teaching interest, this Pariksha Guna. So I made all our teachers as Parikshakas, because they are the one who is going to, not Pariksha, because they do the Pariksha, that's why Parikshaka. I made it with the interest that shaping a future of a student is always in the hand of a teacher. So the teachers is very, very important to have a good knowledge and able to communicate and use it with a positive feeling. Yes, next one. Thank you. it all went above the head. Then unless we tell the importance of Samhita, there is no chance for the student to realize that there is something really treasure is there inside the, because without Aptapadesha, even we can't understand what is there in it, right? So being a teacher, it's become a responsibility to show there is a need for seeing the Samhitas with the interest of practice and utilize it with a proper way.
As in the 8th chapter of Bhimanstan, there is Dasabit Pariksha is mentioned here. So first is your Prakriti is there. So during a patient, how the Prakriti can be assessed, ma'am? Because in the Vyadhi Avastha, Vikruti Avastha, then how the Prakriti can be assessed, ma'am?
If you go with the lines of Vagbhata, then no. He says Anushilanena Prakriti should be administered. With the Vyadhi Avastha, how Prakriti can be assessed. So, actually, if we go with the rules of Vagbhata, then we have to say, no, we can't assess, because he says, Prakritim Anushilanena. We have to be with the patient, then only you have to declare the Prakriti of the person. Whatever the Prakriti is there, it cannot be hidden for long. That's why he given a criteria. If you want to explore a person, whatever the person wants to disguise, it cannot be disguised for long. That's why Anushilanena is the word used. So be there with the patient for a good span of time, then establish the Prakriti of the person. Even it is Vyadhi Prakriti, it cannot be for a long time. So I take this opportunity to thank you. Thank you, ma'am, very much for giving this opportunity. And thank you for all of you for your patience hearing. Though it is a post-lunch session, so after my explanation on what is the importance of not to keeping here, there was hardly any hand below the chin. So I'm very much thankful for listening to me. Thank you.
Thank you very much, ma'am, for the knowledgeable session and telling us how important the Indriyasthana and Vimanasthanas are. I request Dr. Nalina to escort madam. I request Principal ma'am to felicitate Dr. Mallika ma'am.
भिषजां साधुवृत्तानां भद्रमागमशालिनां अभ्यस्तः कर्मणां भद्रं भद्राभिलाषिणां अभ्यस्तः कर्मणां भद्रम. That was the word that came to my mind when I was hearing her depict Vimana and the Indriyasthana so beautifully. She just summarized the entire thing. To me, it was like sitting in a class again. As I was hearing you, I was thinking of the Nidana that we had studied long ago. Why is the order of Nidana in that particular way? Jvara, Raktapitta, Gulma, Prameha, Kushta, Shodha, Unmada, Apasmara. So why is the order of that so? And then we were told that Jvara for Rasa, Raktapitta for Raktadhatu, and then comes Gulma for Mamsadhatu, Prameha for Medhas, Kushta. Up to the Astigata Vyadi, we have the Chikitsa. Majja and Dhatugata, once it gets in, then it is Asadhya. So Kushta signifying the other three Dhatus, along with the Asti, the other two. Shodha, which said it can occur at any level, in any of the Saptadhatu level. And then the Unmada and Apasmara for Rajas and Tamas. So this was the order in which, unless somebody, that's what I was referring to when I said the key to open the Samhita, the Shastra, Ayurveda per se, lies only with the teacher of Siddhanta, with nobody else. They don't need a teacher for most of the other subjects where they can open the text. But no text can tell me this order or this way, especially the OPD slide. That was actually the most catchy in the whole thing. When you when you put it across, why do we go that way in the Vimanasthana, and how beautifully you correlate each adhyaya to what happens in the OPD. In fact, you wanted to skip that slide, the most important slide. And in the last one, when she said Vak Shuddhi, I was reminded of Sushruta's sentence of Vak Saushtave, Pragalbye, Karmanai Pude. I guess, Mallika, you have mastered the art of it, and very happy that you could come to our college and deliver this lecture to our young colleagues, the juniors, who further, I'm sure, will take it out. I wish we have more interaction from you, more questions to her. She's one of the most seasoned teachers in the state. So probably you should interact a little more now during the tea break also. I guess you have a tea break now? No, next session. And probably ma'am will stay back for a while. Yeah. So thank you, Mallika. On behalf of all of them, I extend a sincere thanks to you.